So you've reached out because your furry friend has some, let's say, interesting eating habits. We're here to really
Yeah.
dig into what might be going on.
Exactly. This deep dive, it's all about pica and coprophagia in dogs and cats.
Okay.
And pica, simply put, is eating things that aren't actually food. Toys, rocks, bits of furniture.
Right. Anything non-food. And coprophagia.
That's the specific one, eating feces.
Got it. So our mission today really is to unpack these behaviors. We want to explore the potential reasons behind them, look at what's important for you to maybe consider, and try to do it without, overwhelming everyone with jargon. We've looked at the info you shared, and there's definitely a lot to unpack.
Yeah, there is. Let's maybe start with pica again, just to be clear. Eating non-food stuff. And the range is quite wide, isn't it?
It really is. For dogs, the sources mention things like rocks, clothing, socks.
Yeah, but classic missing sock.
Exactly. And cats, maybe more like fabrics, wool, or even plastic sometimes.
That seems to be the pattern, yes. Fabrics, plastics for cats.
And it might seem quirky, maybe even a bit funny sometimes, but it's really important to remember pica is often a sign, isn't it? A sign that something else is happening.
That's a crucial point. It often signals an underlying issue. The sources we looked at point to several potential medical causes.
Like what kind of things?
Well, things like nutritional deficiencies, maybe they're not getting enough of something, or electrolyte imbalances,
Okay.
gastrointestinal problems, definitely, or sometimes just a big increase in appetite overall. The term is polyphagia.
Polyphagia, right?
It's like their body is driving them to eat anything. And sometimes it's linked to issues in the central nervous system, too.
Wow. Okay, so it's not always just about what they're missing, nutritionally speaking.
Not always, no.
Yeah.
It could be how the brain's signaling appetite. And sometimes the diet itself is the trigger. Very calorie-restricted diets or ones that aren't balanced correctly.
That could make them sort of desperately hungry.
Precisely, leading them to scavenge or eat inappropriate things.
Okay. Now, let's switch gears slightly to coprophagia eating feces. It's technically a type of pica, right?
It is, under the broad definition. But here's where it gets interesting, based on the information we have.
It all on?
Unlike many other forms of pica, coprophagia isn't always a red flag. It's not automatically a sign of a medical problem.
Okay, that's a key difference then. So, how common are these behaviors? Do we know? And what about dogs versus cats?
Well, exact numbers are hard to come by. The sources suggest we don't have precise incidence rates,
Right.
but we do see clear trends. Coprophagia, it's actually pretty common in dogs, quite common,
Really?
but it's considered rare in cats.
Yeah.
Very rare.
That's probably a relief for cat owners. And what about pica in general?
Pica itself, eating other non-food things, we see that in both species, dogs and cats.
Okay. And I think I read something that are certain breeds more prone? Like Siamese cats?
Yes, the information does suggest that certain breeds, and Siamese were mentioned, might have a higher tendency towards pica, particularly fabric eating.
Interesting. And age, does that play a part?
It seems to. Pica is seen more often in puppies, that exploratory phase maybe. And for cats, it often seems to start within their first year.
Okay. So if you're an owner, what might you actually see? What are the signs to look out for?
Well, the obvious one is catching them in the act, or finding the evidence, right?
Missing items, chewed plastic.
Exactly. For dogs, you might see them eating rocks, parts of clothing, or, well, feces for coprophagia.
And for cats, watch out for chewing or ingesting fabrics, string, plastic bits.
Yes. But it's not just about seeing the act itself. There can be physical clues, too.
Ah, okay. Like what?
With coprophagia, pretty obviously you might notice really bad breath.
Makes sense.
If they're eating hard things like rocks, you can see dental damage, worn teeth, broken teeth.
Ouch.
And if there's an underlying issue causing it, like, say, anemia,
Which is low red blood cell.
right, you might notice your pet seems pale, maybe weak. If it's related to poor digestion, they might just look in poor overall condition, maybe lose weight. And in those rarer cases where it's linked to a neurological problem, you might even see neurological signs, though that's less common.
Got it. Let's dig into the why a bit more. Starting with behavioral reasons. Coprophagia, eating feces, it has some really fascinating potential roots, doesn't it? It's not just weird.
Not at all. I mean, first off, it's completely normal for mother dogs to clean up after their puppies. That's maternal coprophagia.
Okay, that makes sense. Instinctive cleaning.
And it's also considered pretty normal exploratory behavior for puppies. They explore the world with their mouth.
Putting everything in their mouth phase.
Exactly. And there's even this interesting theory mentioned about a substance in feces, deoxycholic acid,
Yeah.
that it might somehow play a role in the development of the puppy's nervous system. It's just a theory, but it's out there.
Wow. That's unexpected. And what about what they eat? I heard dogs are sometimes drawn to cat feces.
Yes. Apparently, cat feces can be quite high in protein, making it appealing.
Mm.
And things like horse or deer droppings. They contain partially digested plant matter, which might also attract some dogs, almost like they're seeking something out.
Or it just smells interesting to them, maybe.
Could be. And linking back to what we said earlier, diet definitely plays a role behaviorally too. Being on a restricted diet, feeling hungry,
Makes them less picky.
right?
Right.
Increases the chance they'll eat feces or other non-food items.
And can it become like a habit? Almost rewarding?
The sources suggest that's possible, yeah. For some dogs, the act itself might become self-rewarding somehow. We don't fully understand why.
Okay. And there's a really important point about house training, isn't there?
Hugely important. If a dog is punished, especially harshly, for having accidents indoors.
They might try to hide the evidence.
Exactly. They might start eating their feces to avoid the punishment. It becomes an avoidance behavior driven by fear.
That's really sad, actually, and crucial for owners to understand. What about this nest cleaning idea?
That's another theory sometimes floated for dogs eating their own feces. An instinct to keep their space clean. But again, it's not a universally accepted reason.
Right.
And then there's attention seeking. If eating poop gets a big reaction from the owner,
Even a negative one.
even a negative one is still attention, so they might repeat it. And, surprisingly perhaps, anxiety can sometimes be at the root of coprophagia too.
Okay. What about the behavioral drivers for pica eating other non-food things?
It can be linked to other behaviors, like stealing. A dog grabs something forbidden,
Like a sock.
right, and they might quickly swallow it to stop you from taking it back. Or maybe just having the forbidden item makes it more desirable to consume.
Ah, the keep away game gone wrong.
Sort of. And like with coprophagia, anxiety can be a factor in pica. An anxious dog might start destructively chewing things.
And then accidentally or intentionally swallow pieces.
Exactly. The chewing itself might be anxiety relief, and then it escalates to ingestion.
Okay, so lots of potential behavioral reasons. But then there are the medical causes, which sounds like quite a list. This really underlines why seeing a vet is so important.
Absolutely essential. Medically, we're looking at things like, as we mentioned, anemia, also malnutrition or conditions causing that increased appetite, that polyphagia.
Right.
Hormonal disorders are big ones, hyperthyroidism, especially in cats, diabetes, Cushing's disease,
Okay.
problems with actually digesting or absorbing food that could be things like exocrine pancreatic insufficiency or EPI,
EPI.
inflammatory bowel disease, IBD, or small intestinal bacterial overgrowth, SIBO,
Lots of gut issues.
definitely. Also, certain liver diseases like portosystemic shunts where blood bypasses the liver, even intestinal parasites can sometimes trigger these behaviors. As we touched on, some central nervous system diseases.
That is a comprehensive list. And you mentioned medications earlier, too.
Yes, certain drugs are known to increase appetite as a side effect, which could then lead to pica or coprophagia.
Like what?
Corticosteroids, like prednisone, are a common one. Progestins, phenobarbital used for seizures, and benzodiazepines used for anxiety sometimes.
Good to know if your pet is on any of those. So putting it all together, what are the big risk factors? What makes a pet more likely to start doing this?
Well, for kittens, the sources mention early weaning, potentially leading to that fabric sucking, which can turn into ingestion.
Okay.
In cats generally, maybe diets low in fiber or not having access to roughage like grass, which some seem to need.
Right. Some cats love chewing grass.
They do. For dogs, a big one is lack of stimulation, not enough mental activity, not enough physical exercise, not enough social interaction.
Boredom, basically.
Boredom and unmet needs, yeah. And being confined for long stretches, especially in a boring environment, that also increases the risk.
Okay, so if you suspect this is happening, what's the diagnostic process like? It sounds like it's more involved than just, yep, he ate a rock.
Oh, much more involved. It always starts with a really detailed history from you, the owner.
What kind of details?
Everything. When did it start? Exactly what are they eating? Where and when does it happen? How have you reacted? Any changes in the home? Routine, diet, feeding schedule, any other weird oral behaviors? How's house training been? How do they get along with other pets? What's their typical day like?
Wow, okay. Be prepared to give a full report.
Absolutely. All those details are clues. Then a full physical exam, checking overall health, weight, appetite, looking for signs of nausea, checking the teeth, listening to the gut, looking at the stool itself, and importantly, trying to differentiate true pica from just, say, destructive chewing, where they aren't necessarily intending to swallow, or eating things that just happen to smell or taste like food, like garbage rating.
That's a good distinction. Then tests, blood work.
Definitely. Blood tests, urine tests, maybe specific blood tests looking at pancreatic function, like TLI, or vitamin levels like folate and cobalamin, which tell us about gut absorption. Fecal tests are crucial, looking for parasites, checking for fat or undigested protein, maybe a thyroid panel, especially for cats. Liver function tests, like bile acids. Tests for Cushing's, like an ACTH stimulation test.
So ruling out all those medical conditions we listed.
Exactly. And findings on those tests can point fingers, like specific types of anemia or crystals in the urine might suggest a liver shunt, for example.
And imaging, x-rays.
Yes, X-rays or ultrasound are often needed. Firstly, to check if they've already swallowed something dangerous that needs removing a foreign body,
Right, the immediate danger.
and also to look for signs of underlying disease, like a small liver, which again could suggest a shunt or signs of IBD. Sometimes more advanced things like biopsies or cultures from the GI tract might be necessary.
Okay, quite a workup potentially. So let's say you have a diagnosis, or at least a strong suspicion of the cause. How do you treat it? Let's start with Pica.
For Pica, the absolute #1 thing is management, preventing access.
Makes sense. If they can't get it, they can't eat it.
Exactly. So that means meticulous tidiness, confining the pet when unsupervised, maybe using a basket muzzle on walks, for dogs used safely and correctly, of course.
Right. Need to be careful with muzzles.
Absolutely. Maybe using deterrents on objects, like sticky tape or bitter sprays, though those aren't foolproof. Dietary changes can sometimes help, maybe more fiber to help them feel full,
Okay.
and providing lots and lots of appropriate things to chew and interact with. Food puzzle toys are great. Safe plants for cats who like greenery.
Redirecting the urge.
Precisely. And training is key too. A really solid leave it or drop it command is invaluable.
Essential skills.
And if it seems more like a compulsive disorder, that might need specific behavioral modification plans, potentially medication.
Okay. What about compulphagia? How do you tackle that?
Again, preventing access is paramount. Strict leash walking, cleaning up feces immediately.
No, leaving it lying around.
Zero chance. Muzzles can work here too, again with careful fitting and supervision. Head halters can give better control to steer them away quickly. Some sources mention things like remote citronella collars, used to interrupt the sniffing or ingesting, but only if paired with positive reinforcement for moving away. It needs careful timing and training.
Okay. What about those food additives or things you put on the poop to make it taste bad? Do they work?
You know, the general consensus from the information we reviewed is that there's not much solid evidence they work reliably long-term.
Oh, really? I thought that was a standard thing.
People definitely try them, things like meat tenderizer in the food or hot sauce on the stool. But pets can be smart. They might just avoid the treated poop and eat the untreated stuff, or just get used to the taste. It's generally not seen as a primary solution.
So again, it comes back to management and addressing the root cause.
Exactly. For both Pica and Polyphagia, increasing mental and physical stimulation is huge. A bored dog is more likely to engage in these things. Predictable routines can also help reduce underlying anxiety.
Makes sense.
And sometimes, for Polyphagia, dietary tweaks might help some individuals, maybe a more highly digestible diet, or adding those digestive enzyme supplements. Worth discussing with the vet, but not a magic bullet.
Right. So what are the really key messages for owners dealing with this, the main takeaways?
Okay, first, especially with Polyphagia in dogs, try to remember it's common, often not physically harmful unless there are parasites or pathogens involved, but get it checked out.
Okay, take a breath.
Second, and this is critical, do not punish.
Say it again.
Do not punish your pet for Pica or Polyphagia. It's very likely to increase fear and anxiety, which can make the behavior worse or cause new problems. It doesn't teach them what to do.
Super important point.
Management, supervision, and preventing access, that's your most powerful tool. Be vigilant.
Okay. What about medications for the behavior itself?
If anxiety is diagnosed as a primary driver, then yes, vets might consider psychoactive meds like SSRIs or TCAs, but that's a careful decision, weighing pros and cons, potential side effects, and making sure other medical causes are ruled out or managed. And you'd want to avoid any meds that increase appetite if possible.
Got it. It's not a first-line thing.
Generally not, no. And follow is key. This often isn't a quick fix. You'll likely need check-ins with your vet to monitor progress and adjust the plan.
Right, and prevention. For people getting a new pet, maybe.
Good point. Manage access from the start. Be super careful and positive with house training to avoid that punishment hiding cycle. Keep up with regular parasite checks and prevention.
Solid advice. And we should probably mention the biggest risk of pica again.
Yes, absolutely. Foreign body obstruction. If your pet swallows something indigestible, it can get stuck in their gut, which is a life-threatening emergency requiring surgery. That's the most serious potential outcome of pica.
Okay, definitely something to be aware of. So what's the overall outlook? Can these behaviors be stopped?
It varies. The prognosis is often considered more guarded if it's a really long-standing habit, or if realistically the owner can't provide the necessary supervision or implement the management consistently. It takes commitment.
But if they can,
If they can stick with the supervision and the plan, address any underlying medical stuff, provide enrichment, the outlook is generally much better. Improvement is definitely possible.
Okay, so to sort of wrap this up, Pica and copriphagia, they can stem from so many different things, can't they? From just normal puppy stuff to complex medical conditions or behavioral issues like anxiety.
Absolutely. Understanding that potential why is really the first crucial step. You can't effectively treat it if you don't know what's driving it.
And the key seems to be careful observation, getting that professional veterinary diagnosis, and then focusing on management, preventing access, enrichment, addressing the root cause rather than getting frustrated or resorting to punishment.
Couldn't have said it better myself.
hmm
Patience, prevention, and professional guidance.
So a final thought maybe for you listening. Thinking about your own pet, now armed with this information, are there specific behaviors or aspects of their environment that maybe warrant a closer look? What's one small step you could take? Maybe just observing more closely or preparing questions for your vet to address these things proactively. Definitely some food for thought.
Indeed.
Thanks for taking this deep dive with us today.